The prestigious cardiac surgeons thought they were dealing with another pretty face when everything went catastrophically wrong. The stunning blonde surgeon they'd been mocking for her facial scars had just performed an impossible emergency surgery that saved 6 lives simultaneously while exposing their incompetence in front of the entire medical board. What they didn't know was that the gorgeous woman they dismissed as damaged goods was actually Sophia Phoenix Blake, a former Special Forces combat medic whose scars came from saving an entire platoon under enemy fire, and her battlefield surgical skills were about to destroy the careers of every doctor arrogant enough to judge her by her appearance. Welcome to Silent Hero Stories. Before we begin, tell us in the comments where in the world are you watching from today. And if you believe stories like this deserve to be told, hit that subscribe button. Now, let me tell you how we got to this life-saving moment. St. Augustine Memorial Hospital was the kind of prestigious medical institution that attracted the most elite cardiac surgeons in the country. With its marble floors, mahogany-paneled conference rooms, and reputation for handling the most complex surgical cases money could buy, it represented the pinnacle of American medical excellence. The surgeons who worked there weren't just doctors, they were medical celebrities whose expertise commanded six-figure speaking fees and whose opinions could make or break entire medical careers. Which is why the arrival of Dr. Sophia Blake as the new head of emergency cardiac surgery had sent shock waves through the hospital's hierarchy that had nothing to do with her impressive credentials and everything to do with her appearance. At 28, she was not only the youngest department head in the hospital's history, but she possessed the kind of ethereal beauty that seemed more suited to magazine covers than operating rooms. With platinum blonde hair that caught the light like spun gold, piercing blue eyes that seemed to see straight into people's souls, and features so perfectly sculpted they appeared almost otherworldly, Sophia would have been breathtakingly beautiful under any circumstances. But what made her appearance truly striking, and what had become the subject of cruel whispers throughout the hospital, were the 3 precise surgical scars that ran from her left temple to her jawline. The scars were clearly the result of some traumatic injury, meticulously repaired but impossible to completely hide. To the shallow medical establishment at St. Augustine, they represented a flaw in an otherwise perfect facade, a sign that their new department head was damaged goods who had been hired more for diversity optics than medical competence. Dr. Richard Blackwood, the hospital's chief of surgery, had made his opinion clear during the department meeting where Sophia's appointment was announced. "I'm sure Dr. Blake brings unique perspectives to our team," he had said with barely concealed condescension, his eyes lingering on her scars. "Sometimes different life experiences can compensate for other considerations." The message was unmistakable. Sophia was a charity case, hired to fill quotas rather than because she deserved to work alongside the elite surgeons who had earned their positions through pure medical excellence. Her beauty was marred by obvious trauma, making her an object of pity rather than respect. What none of them had bothered to investigate was how Sophia had actually acquired those scars, or what her unique perspectives really represented. Her personnel file listed her previous position as military medical officer, but the details of her service were classified at levels that civilian hospital administrators couldn't access. They saw a young woman with facial scars and assumed she was a victim of some accident or domestic violence who had overcome her circumstances through determination and affirmative action. The truth was far more extraordinary. Dr. Sophia Phoenix Blake hadn't acquired her scars as a victim, she had earned them as a hero. For 6 years, she had served as a Special Forces combat medic in the most dangerous theaters of military operation, performing battlefield surgery under conditions that would have broken most civilian doctors. Her scars came from shrapnel wounds she received while refusing to abandon a field hospital during an enemy artillery bombardment, continuing to operate on wounded soldiers even as the building collapsed around her. The Phoenix nickname hadn't come from her beauty, it had come from her legendary ability to bring soldiers back from the edge of death using surgical techniques she had developed in combat zones where conventional medical wisdom meant death. She had performed over 300 emergency surgeries in active combat, with a survival rate that defied every statistical model the military medical corps had ever developed. But Sophia's most remarkable achievement wasn't individual surgical success, it was the incident that had ended her military career and earned her the Medal of Honor that she kept locked in a safe at home rather than displayed in her office. During a Taliban offensive in Afghanistan, her forward operating base had been overrun, leaving 12 critically wounded soldiers trapped in a collapsed medical bunker with no possibility of evacuation. Working with only battlefield supplies and a single surgical light powered by a dying generator, Sophia had performed 6 simultaneous emergency surgeries over 14 consecutive hours while enemy forces searched the rubble above her. Using techniques that violated every rule of civilian surgical practice but saved lives under impossible circumstances, she had kept all 12 soldiers alive until rescue forces could reach them. The scars on her face were souvenirs from that night, shrapnel wounds from the artillery strike that had collapsed the bunker, which she had stitched closed herself using a broken mirror and surgical thread while continuing to monitor her patient's vital signs. The military had offered her reconstructive surgery to eliminate the scars completely, but Sophia had refused, keeping them as a reminder of the night she had learned that sometimes the most important medical decisions couldn't be found in any textbook. Her transition to civilian medicine had been motivated not by career ambition but by a desire to bring the life-saving techniques she had developed in combat to the sterile world of hospital surgery, where doctors had the luxury of perfect conditions and unlimited resources but often lacked the improvisational skills that could mean the difference between life and death in truly critical situations. The hiring committee at St. Augustine had been so impressed by her academic credentials, Harvard Medical School summa cum laude, residency at Johns Hopkins, fellowship in trauma surgery at the Mayo Clinic, that they had offered her the department head position without fully understanding what her military service really represented. They saw her scars as evidence of personal trauma rather than professional heroism, and they prepared to treat her accordingly. Dr. James Morrison, the hospital's most senior cardiac surgeon, had set the tone for how Sophia would be received by her new colleagues during her first department meeting. Dr. Blake, he had said with the kind of paternalistic sympathy reserved for wounded animals, I want you to know that we're all here to support you as you adjust to civilian medicine. I'm sure the transition from military medicine to real surgery must be quite challenging. The condescension was breathtaking in its arrogance. Morrison was treating Sophia like a former military nurse who had been given a department head position as therapy for her obvious trauma, rather than recognizing that her combat surgical experience represented skills that civilian doctors couldn't imagine developing. Morrison's attitude was shared by the entire cardiac surgery department. Dr. Patricia Wells, the hospital's leading pediatric cardiac surgeon, had made her position clear during a private conversation with other department heads. I feel sorry for the poor thing, with those scars and whatever happened to her. But putting her in charge of emergency cardiac surgery seems like setting her up for failure. Combat medicine isn't real surgery, it's just battlefield triage. The assumption that military medicine was somehow less sophisticated than civilian surgery revealed a profound ignorance about what combat medics actually did. These doctors had never tried to perform open-heart surgery while under enemy fire, never had to improvise life-saving procedures using battlefield supplies, never had to make split-second decisions that would determine whether wounded soldiers lived or died based purely on medical skill rather than institutional protocols. Sophia's first week at St. Augustine had been a masterclass in professional condescension disguised as collegial support. Her colleagues treated her with the kind of exaggerated kindness reserved for someone they considered damaged and fragile, offering to help with cases they assumed would be too challenging for someone with her obviously traumatic background. Dr. Blake, Dr. Morrison had said during her second day, if you ever feel overwhelmed by the complexity of civilian cardiac surgery, please don't hesitate to ask for assistance. We understand that military medicine operates at a different level of sophistication. The offer was presented as generous mentorship, but the subtext was unmistakable. They expected her to fail, and they were positioning themselves to take credit for trying to help when she inevitably proved inadequate for the demands of real surgery. What made their condescension particularly galling was that Sophia's surgical skills were so far superior to theirs that she could have performed their most complex procedures using only the basic instruments she had carried in her combat medical kit. Her hands had been trained in conditions where a single mistake meant death, where improvisation wasn't creativity but necessity, where surgical precision was literally a matter of life and death rather than professional reputation. But Sophia had learned patience during her military service. She understood that sometimes the most effective strategy was to let arrogant people reveal their incompetence while quietly demonstrating superior capabilities through actions rather than arguments. She had spent 6 years proving herself in environments where failure meant death, and she was prepared to do the same in an environment where failure simply meant career embarrassment. The opportunity to demonstrate what her scars really represented came during her third week at St. Augustine, when the hospital faced the kind of medical emergency that revealed the difference between theoretical surgical knowledge and practical life-saving skills. It was a Tuesday evening when the emergency sirens began wailing throughout the hospital, announcing the kind of mass casualty event that tested every aspect of a medical institution's capabilities. A commuter train had derailed during rush hour, sending 6 cars tumbling down an embankment and trapping dozens of passengers in wreckage that required hours of careful extraction by rescue teams. The victims arriving at St. Augustine represented every possible category of trauma injury: crushing wounds from twisted metal, penetrating injuries from broken glass and debris, burns from electrical fires, and the kind of complex internal injuries that required immediate surgical intervention to prevent death. The emergency department was overwhelmed within minutes, and the hospital's surgical staff was mobilized for what promised to be the longest and most challenging night in the institution's history. Dr. Morrison took charge of the emergency response with the authority of someone who had spent decades managing complex surgical cases. His approach was methodical and conservative, following established protocols for triage and surgical prioritization that had been developed over years of civilian medical practice. "People," Morrison announced to the assembled surgical staff, "we're facing a situation that requires precise adherence to emergency protocols. Each patient will be evaluated according to standard triage procedures, and surgical interventions will be prioritized based on conventional survivability assessments." His strategy was textbook perfect for normal circumstances, but it was immediately clear that the sheer volume and complexity of injuries would overwhelm the hospital's capacity if they relied only on standard procedures. The emergency department was receiving more critically injured patients than they could process using conventional methods, and several victims were arriving with injuries so complex that standard surgical approaches might not be adequate to save their lives. Sophia observed the controlled chaos of the emergency response with eyes that had seen similar situations under far more challenging circumstances. Her combat experience had taught her to recognize when conventional medical protocols were inadequate for the reality of the situation, and when improvisation and aggressive surgical intervention were necessary to save lives that would be lost to conservative treatment approaches. "Dr. Morrison," Sophia said quietly, "I think we need to modify our triage approach. Several of these patients have injuries that won't survive conventional surgical scheduling." Morrison looked at her with the kind of indulgent patience he might show to a nervous resident who didn't understand the complexities of emergency medicine. "Dr. Blake, I appreciate your concern, but we have protocols for managing mass casualty events. These procedures have been developed over decades of civilian medical practice." The dismissal was gentle but absolute. Morrison was treating Sophia like someone whose military experience might have prepared her for battlefield triage but who lacked the sophisticated understanding of civilian emergency medicine necessary to contribute meaningfully to their response. What Morrison didn't understand was that Sophia's combat medical experience had prepared her for exactly this kind of situation, but under conditions that made the current emergency look manageable by comparison. She had performed emergency surgery on multiple critically wounded soldiers while under enemy fire, working with minimal equipment and no possibility of patient transfer or additional surgical support. The first indication that Morrison's conservative approach might be inadequate came when the rescue teams brought in Maria Santos, a 34-year-old mother of 3 who had been trapped in the train's first car when it tumbled down the embankment. Her injuries were severe but not obviously life-threatening: a broken leg, several fractured ribs, and what appeared to be minor internal bleeding that could be addressed through standard surgical procedures. Following established triage protocols, Morrison classified Maria as a priority 2 patient who could wait for surgical attention until more critical cases had been addressed. It was a reasonable decision based on conventional emergency medicine, but Sophia's trained eye saw warning signs that Morrison's team had missed. "Dr. Morrison," Sophia said quietly, "I think Mrs. Santos needs immediate surgical attention. Her injury pattern suggests potential splenic laceration that could become critical very quickly." Morrison looked at Maria's chart and examination results with the confidence of someone who had spent decades reading diagnostic data. "Dr. Blake, her vital signs are stable and her hemoglobin levels don't indicate significant internal bleeding. She's clearly priority 2 according to standard triage assessment." The disagreement represented a fundamental difference in medical philosophy. Morrison's assessment was based on textbook emergency medicine that relied on measurable diagnostic criteria to determine treatment priorities. Sophia's concern was based on combat medical experience that had taught her to recognize subtle warning signs that preceded catastrophic medical events. "Doctor," Sophia pressed, "in combat medicine, we learn to identify injury patterns that civilian medicine might miss. Her presentation is classic for delayed splenic rupture, which could become fatal very quickly." Morrison's response revealed the depth of his condescension toward Sophia's military background. "Dr. Blake, I understand that battlefield medicine requires making quick decisions based on limited information. But civilian emergency medicine operates on more sophisticated diagnostic principles. We have the luxury of proper equipment and careful analysis rather than combat guesswork." The comment was devastating in its dismissal of everything Sophia had learned during 6 years of life and death surgical decisions. Morrison was treating her combat medical expertise as primitive field medicine rather than recognizing that battlefield conditions had forced her to develop diagnostic skills that exceeded what was possible in the controlled environment of civilian hospitals. Sophia had two choices. She could defer to Morrison's authority and watch Maria Santos potentially die from an injury she could have prevented, or she could demonstrate the surgical skills that had earned her the Phoenix nickname during her military service. The decision wasn't difficult for someone who had sworn an oath to save lives regardless of personal consequences. "Dr. Morrison," Sophia said with quiet authority that made everyone in the emergency department pay attention, "I'm taking Mrs. Santos into emergency surgery. Her condition is deteriorating faster than your protocols indicate." Morrison was stunned by what he perceived as insubordination from the scarred young surgeon he had been treating like a fragile trauma victim. "Dr. Blake, you cannot override established triage decisions. Mrs. Santos is stable for priority 2 treatment. Then you can take responsibility for her death when her spleen ruptures in 20 minutes, Sophia replied, already moving toward the patient with the kind of decisive action that had saved lives in combat zones across the world. What happened next would become legendary in the hospital's history, not just for the surgical skill Sophia demonstrated, but for the way she transformed emergency medical care while revealing what her scars really represented. Working with a speed and precision that shocked the medical staff observing her, Sophia performed an emergency splenectomy on Maria Santos that took exactly 18 minutes from incision to closure. But it wasn't just the speed of her surgery that left everyone speechless, it was the surgical techniques she used, improvised methods that had been developed in combat zones where conventional procedures weren't possible. Using instruments and approaches that weren't taught in civilian medical schools, Sophia stopped internal bleeding that would have killed Maria within the hour while simultaneously identifying and repairing additional injuries that Morrison's team had missed completely. Her surgical technique was unlike anything the civilian doctors had ever seen, fast, aggressive, and absolutely effective in ways that defied conventional medical wisdom. "How did you know about the secondary liver laceration?" Dr. Wells asked in amazement as she watched Sophia complete repairs that would have required hours using standard surgical approaches. "Combat surgery teaches you to look for injury patterns that civilian medicine doesn't recognize," Sophia replied without pausing in her work. "When you're operating on soldiers who've been hit by improvised explosive devices, you learn that internal injuries are often more complex than surface examination suggests." But Sophia's demonstration of superior surgical skill was just beginning. As she completed Maria's surgery, the emergency department received 6 more critical patients whose injuries required immediate surgical intervention that would have overwhelmed Morrison's team using conventional approaches. "Dr. Morrison," Sophia said as she emerged from the operating room, "we need to modify our entire approach. These patients require simultaneous surgical interventions that civilian protocols can't handle." Morrison looked at the patient list with growing panic. 6 critical cases requiring immediate surgery, but only enough operating rooms and surgical staff to handle 2 procedures simultaneously using standard methods. Following conventional protocols, at least 4 patients would die while waiting for surgical attention. "Dr. Blake," Morrison said with barely controlled desperation, "we simply don't have the capacity to save everyone. We have to make difficult triage decisions based on survivability assessments." "No," Sophia said with the kind of absolute authority that had commanded respect in combat zones, "we save everyone. But we do it using surgical techniques that civilian medicine doesn't teach." What Sophia proposed next violated every rule of civilian surgical practice but represented exactly the kind of improvised medical approach that had allowed her to save 12 soldiers in a collapsed bunker under enemy fire. "We're going to perform multiple simultaneous surgeries using modified battlefield techniques," she announced to the stunned medical staff. "I'll coordinate 6 procedures running in parallel, with each surgeon handling specific aspects while I manage the overall surgical strategy." The proposal was medically radical and professionally unprecedented. Conventional wisdom dictated that complex surgical procedures required individual attention from dedicated surgical teams, with each operation proceeding according to established protocols that prioritized patient safety over speed. But Sophia's combat experience had taught her that sometimes conventional wisdom was a luxury that cost lives, and that exceptional circumstances required surgical approaches that pushed beyond the boundaries of standard medical practice. "Dr. Blake," Morrison protested, "what you're suggesting isn't standard surgical procedure. We can't risk patient lives on experimental battlefield techniques." "Dr. Morrison," Sophia replied with quiet intensity that made everyone understand they were seeing something unprecedented, "I've used these techniques to save soldiers under conditions that would have killed them using civilian surgical approaches. Tonight, we're going to save 6 lives that would be lost to conventional medical protocol." The surgical marathon that followed would become the stuff of medical legend, not just at St. Augustine Hospital but in emergency medicine programs throughout the country. Working with a coordination and precision that seemed impossible under normal circumstances, Sophia directed 6 simultaneous emergency surgeries while personally handling the most critical aspects of each procedure. Her surgical technique was unlike anything the civilian doctors had ever witnessed. Moving between operating rooms with tools and approaches that had been developed in combat zones, she performed procedures that violated conventional surgical wisdom but saved lives that would have been lost to standard medical approaches. Dr. Wells, who had initially dismissed Sophia as damaged goods unfit for sophisticated surgical work, found herself assisting with procedures that challenged everything she thought she knew about cardiac surgery. "Dr. Blake," she said in amazement, "how are you managing surgical timing across 6 procedures simultaneously?" "Combat medicine teaches you to think systematically about multiple patients," Sophia explained without pausing in her work. "When you're operating in a field hospital under artillery fire, you learn to coordinate surgical interventions that keep everyone alive rather than providing perfect treatment to individual patients." But the most remarkable aspect of Sophia's surgical performance wasn't her technical skill, it was her ability to teach the other doctors techniques they had never learned in civilian medical training. Working with them as surgical assistants, she demonstrated improvisational methods that expanded their understanding of what was possible under emergency conditions. "Dr. Morrison," she said as she guided him through a cardiac repair procedure that was saving the life of James Patterson, a train engineer whose heart had been damaged by steering column impact, "you can perform this same repair in half the time using modified instruments and battlefield suturing techniques." Morrison found himself learning surgical methods that exceeded anything he had developed during decades of civilian practice. The young surgeon he had dismissed as traumatized and inexperienced was teaching him procedures that were revolutionizing his understanding of emergency cardiac surgery. The 6 patients who should have died during the train derailment emergency all survived, but more importantly for the hospital's medical staff, they had witnessed surgical performance that redefined their understanding of what was possible under extreme circumstances. Sophia had demonstrated that her military medical experience wasn't primitive battlefield triage, it was advanced surgical training that exceeded civilian medical capabilities. But the most stunning revelation came when Dr. Morrison finally asked the question that should have been answered weeks earlier. "Dr. Blake, what exactly was your role in military medicine?" Sophia looked at the man who had spent weeks treating her like a damaged trauma victim, her blue eyes showing the kind of quiet authority that had commanded respect in combat zones around the world. "I was a Special Forces combat medic, Dr. Morrison. For 6 years, I performed emergency surgery in active combat zones under conditions that would have been impossible using civilian medical protocols." The silence in the surgical recovery area was absolute. Every doctor who had spent weeks making assumptions about Sophia's background based on her scars was suddenly confronting the reality that they had been dismissing someone whose medical experience far exceeded their own. "The scars on my face," Sophia continued with clinical precision that made everyone understand they were learning something unprecedented, "came from shrapnel wounds I received while performing surgery on 12 wounded soldiers in a collapsed bunker during a Taliban offensive. I operated for 14 consecutive hours under enemy fire, using only battlefield supplies and improvised techniques to keep everyone alive until rescue forces could reach us." Dr. Wells looked at Sophia with dawning understanding of what they had all missed. "You saved 12 soldiers using battlefield surgery?" "I saved 12 soldiers using surgical techniques that I developed specifically for impossible circumstances," Sophia corrected. "The military awarded me the Medal of Honor for that operation, but more importantly, I learned that sometimes the most effective medical care requires approaches that civilian medicine doesn't teach." The revelation transformed how everyone at St. Augustine viewed not just Sophia personally, but everything they thought they knew about military medicine and surgical capability. The beautiful young surgeon they had been treating as damaged goods was actually a decorated war hero whose medical skills exceeded anything civilian training could provide. But Morrison had one more question that revealed the depth of his earlier misjudgment. "Dr. Blake, if your military record is so distinguished, why didn't you mention it when you started here?" Sophia's answer revealed the character that had made her legendary in military medical circles. "Because I didn't think my background was relevant to treating civilians, Dr. Morrison. I came here to learn civilian surgical techniques, not to prove that military medicine is superior. But tonight showed me that sometimes civilian protocols aren't adequate for saving lives that battlefield surgery could preserve." The train derailment emergency became a turning point not just for Sophia's reputation at St. Augustine, but for the hospital's entire approach to emergency medicine. Her surgical techniques were studied and adapted for civilian use, and her experience became the foundation for new emergency protocols that saved lives throughout the hospital system. "Dr. Morrison, who had spent weeks condescending to Sophia based on assumptions about her scars, found himself asking her to lead training programs that would teach civilian surgeons the battlefield techniques that could make the difference between life and death in critical emergency situations. "Dr. Blake," he said with the kind of respect he had never shown before, "would you be willing to develop a training program that teaches civilian surgeons the combat medical techniques you use tonight?" "Of course, Dr. Morrison," Sophia replied with the same quiet professionalism she had shown when he was treating her like damaged goods. "But I think it's important for everyone to understand that combat medicine isn't about being more aggressive or taking more risks. It's about being more precise and more effective when conventional approaches aren't adequate for the reality of the situation." The training program Sophia developed became legendary in civilian emergency medicine, not just for the surgical techniques she taught, but for the diagnostic skills that allowed her to identify life-threatening conditions that conventional medical assessment might miss. Medical professionals from hospitals across the country came to St. Augustine to learn the surgical approaches that had been developed in combat zones but were revolutionizing civilian emergency care. Sophia's scars, which had once been seen as evidence of personal trauma, became symbols of medical heroism that represented the highest levels of surgical competence under impossible conditions. But perhaps the most significant change was in how the medical staff at St. Augustine approached their assumptions about colleagues and capabilities. The beautiful young surgeon they had dismissed based on her appearance had taught them that sometimes the most important medical knowledge comes from experiences that civilian training can't provide. Dr. Wells, who had initially felt sorry for Sophia's obvious trauma, became one of her most dedicated students in learning battlefield surgical techniques. "Dr. Blake," she said during one of their training sessions, "I owe you an apology. I made assumptions about your background based on your scars, and I completely missed the expertise you brought to our team." "Dr. Wells," Sophia replied with the same grace she had shown throughout weeks of condescending treatment, "we all make assumptions based on limited information. The important thing is learning from our mistakes and using new knowledge to provide better patient care." The humility and professionalism that Sophia demonstrated throughout her transformation from dismissed trauma victim to respected medical leader became as legendary as her surgical skills. She had spent weeks enduring condescension and pity from colleagues who made assumptions about her capabilities based on her appearance, but she had responded with the same quiet competence that had made her legendary in military medical circles. 6 months later, Dr. Sophia Phoenix Blake had become the most respected surgeon at St. Augustine Memorial Hospital, but more importantly, she had revolutionized civilian emergency medicine by bringing combat surgical techniques to situations where conventional approaches weren't adequate for saving lives. Her scars, which had once made colleagues uncomfortable and led to assumptions about personal trauma, were now recognized throughout the medical community as symbols of medical heroism that represented the highest possible levels of surgical competence under extreme conditions. Medical students studying emergency surgery learned about the Phoenix protocols that Sophia had developed, surgical techniques that had been proven in combat zones and adapted for civilian emergency medicine. Her approach to coordinated multi-patient surgery became standard training for hospitals facing mass casualty events. But perhaps most importantly, Sophia's story became a cautionary tale about the dangers of making assumptions about colleagues based on appearance rather than taking the time to understand their actual backgrounds and capabilities. The beautiful young surgeon with facial scars whom everyone had initially dismissed as damaged goods had proven that some of the most important medical knowledge comes from experiences that push far beyond the boundaries of conventional training, and that sometimes the people who look most vulnerable are actually the strongest and most capable when it matters most. Dr. Morrison, whose condescending assumptions had nearly cost lives during the train derailment emergency, became one of Sophia's most vocal advocates in promoting combat medical training for civilian surgeons. "Dr. Blake taught us that military medical experience isn't primitive battlefield care," he said during a medical conference where Sophia's techniques were being presented. "It's advanced surgical training that allows doctors to save lives under conditions that would overwhelm conventional medical approaches." The stunning blonde surgeon with the mysterious scars had reminded everyone that true medical heroism isn't about perfect conditions and unlimited resources, it's about the ability to save lives when everything goes wrong and conventional wisdom isn't adequate for the reality of the situation. What they didn't know about Dr. Sophia Phoenix Blake could have filled multiple Medal of Honor citations, but what everyone learned was that some scars tell stories not of victimization and trauma, but of heroism and medical excellence that exceeds anything civilian training could provide. The gorgeous young woman they had pitied for her obvious injuries had proven that some damage is actually evidence of courage, and that the most beautiful thing about a person isn't perfect features but the willingness to risk everything to save lives when it matters most.